Everyone, and welcome to Morning Coffee. I'm your host, Mark Iorio, along with my pal here, Lisa Manioki. No, they're the same ones.
It's my Halloween glasses.
They're nice. I like them.
Thank you.
And our good friend, Dr. Gerald Smith, is here again with us. How are you, sir?
I'm doing great. Thank you for inviting me back.
You're welcome. It's always a pleasure. I told you that every single time we post our interview with you, we get lots and lots of views and a lot of comments.
Well, thank you.
Because people are interested in what you have to say, and it's not tradition. It's not fluff, right? And it's not the traditional things that you would typically hear from a medical practitioner, right?
Correct.
So today we're going to talk about anxiety, depression, and panic attacks, and what they all have in common.
Basically, hypothyroidism is a common denominator for depression, panic attacks, and anxiety. Why? For the simple reason, when your metabolism's low, in the brain, metabolic wastes build up, and it also decreases the neurotransmitters in the brain, which have to do with feeling well, like the GABA aminobutyric acid is one of them. It has to do with, feeling good. It's an inhibitor, and serotonin is the happy hormone. So these things get diminished, and that's why one of the reasons.
Excuse me, you said hypo or hyper?
Hypo, underactive thyroid.
So for those who don't know what it means, what is it?
Okay, great question. When it's underactive, it means that the cell metabolism slows up. It's kind of like when a bear goes into hibernation, his body slows down,
right,
and he goes through the winter. So basically your organs slow down in their function, which means that the hormones are not being produced the way they should be, and the waste products are not being removed adequately, so you get some adverse side effects.
We talk about this a lot. I think a lot of people dance around panic attacks, anxiety, depression. They don't want to talk about it. It's a mental health disorder. But it's one of the leading causes of disability in the United States, right?
Worldwide.
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 Yeah. Let's talk about that, Dr. Smith, because I think people they suppress a lot of that anxiety and depression and panic attack talk for fear that people are going to look at them and say there's something wrong with them mentally, right?
Well. It's obvious once you understand the mechanisms, the chlorinated water, the fluorine or fluoride in the water in your toothpaste,
right,
the bromine in your baked goods, okay, your adulterated hydrogenated fats,
yes,
okay, they basically all suppress your thyroid function. So that's a given. And now one of the biggest things, I just dug this up yesterday, microwave frequency EMFs produce widespread neuropsychiatric effects, including depression. This is in the medical literature, peer-reviewed literature. And who doesn't get exposed to Wi-Fi today?
Right, exactly. Wi-Fi and microwave waves from, a million different things. Not your microwave oven, but there's millions of microwave transmitters out there.
Absolutely.
Right?
Yeah, it's scary.
It is.
Like people don't realize, a 7-minute phone call with your mobile phone activates Epstein-Barr virus in your body. That's all documented.
Wow.
The frequencies have deleterious effects.
So why do you why? I mean, we're talking about depression. Why is there so much of it in society?
Well, because we're all inundated with EMFs. They have these wireless phones. You have the so-called smart meters, which are giving off Wi-Fi signals in your house. And the quality of the food today is poor. Back in 1929, Congress did a study on the state of the health of the soil. It was deplete in 1929. Today, you're better off eating the cardboard box that the food came in. At least you'll get the fiber.
Oh my goodness.
Don't do that. I think he's just kidding.
Yeah, don't do that, right. So what kind of symptoms, if someone's suffering from depression, let's say it's onset, what would we see?
Well, some people sleep excessively or they don't sleep enough. That's one thing. Other people have fatigue issues, restlessness,
right,
irritability, low libido, and just agitated and poor memory, and they can't make decisions properly. So these are basic symptoms, and it also correlates with hypothyroidism, very similar symptoms.
Why is there such a common thread between depression, anxiety, panic attacks? What's the...
Well, you have to understand that your brain works on emotions, and the neurotransmitters affect your mood. So when that goes haywire, you get anxious, you get insecure, feelings of worthlessness, or even feelings of suicide.
Yeah.
But it's all related to the biochemistry up in your brain, which gets affected when your metabolism decreases.
Yeah.
Well, okay, so a neurotransmitter, explain what that is.
Neurotransmitter is a chemical that makes things work. Kind of, I don't know if you're old enough to remember out there, Lily Tomlin, when she played the operator, she would plug in the wire to make the connection. Well, the neurotransmitter connects the pathways in your brain to make it work properly. And when they're shortchanged, so goes your emotional feelings and so forth.
And we've talked about this on the show countless times, about the pharmaceutical industry and how they will use drugs in order to curb depression or get you out of a depression, but they're not getting to the root cause of what's causing the depression, right?
Yeah, it's a quick fix.
It's a quick fix, right?
Yeah, especially these SSRI drugs, serotonin or selective serotonin uptake inhibitors. They're raising the serotonin level, but like you said, they're not trying to delineate, is it high copper content in your body from your copper pipes from your house? That can cause depression.
Right.
Okay.
Yep.
Certain medications that you're being prescribed can cause depression. Steroids, for example, beta blockers can do it. Your anticonvulsive drugs, Tegretol, for example, Topamax, these things can cause depression just from the drug itself. So there's so many different factors that we're faced with today.
Yeah.
Oh, so you fix one problem and create another, right?
Exactly, because if you're taking the medication, now your body has to metabolize and break down that medication, and the root cause is still going on, so that usually gets worse.
If you watch episodes of whatever you're watching on television, I think the majority of the commercials that are on are related specifically to drugs that are attacking or dealing with depression, anxiety, and panic attacks. I mean, it's a gigantic industry, right?
Well, and also hypothyroidism,
Yeah.
thinning of the hair. Don't you see all these advertisements for hair transplants and
Yeah.
plugs? Okay, acne.
Yeah.
Okay, constipation.
Yeah.
Insomnia, infertility.
Yeah.
Weight gain.
Yeah.
These are all hypothyroid, but it's all interlinked.
Interrelated, yeah.
Now, I can tell you, I had a low thyroid when I was having fertility issues before I had my kids, and that it was a low thyroid.
Really?
And with an adjustment, it was a Synthroid, I believe was the drug of choice at the time.
Yeah.
It just leveled out the
Yeah.
dance, but it's complex. I felt terrible. When it was off, I felt draggy.
Oh, absolutely.
I felt terrible.
Yeah, apathetic.
Yeah.
And the other interesting thing, a lot of the toxins are getting trapped in the thyroid. So, for example, in my practice, I find a lot of glyphosate, which is Roundup, the herbicide,
Really?
trapped in the thyroid. Also, heavy metals like mercury. So if you have mercury fillings in your mouth, they're leaking out 24/7. If you have a root canal, we're the only profession that embalms an organ, keeps it in the human body, chronic inflammation. The toxins, hydrogen sulfide, mercaptan, thioethers, which are related to mustard gas, are draining from your teeth down into the thyroid. And your traditional physicians and most dentists are not aware of this.
You've said it a number of times on the show. You've been on the show, our show, at least 3 or 4 times. And when you come on, Dr. Smith, you talk about finding trapped, toxic issues in certain organs. How do you do that? How do you find those trapped issues and
Okay,
toxins.
let me give you a little bit of background about the universe. Everything in the universe is based on frequencies. So your coffee vibrates at a specific frequency. Okay, your organs vibrate at a specific frequency. Mercury vibrates at a frequency. So, for argument's sake, if I have a little vial that has mercury in it, for example, and I hold that vial over an area of your body, over an organ or your brain, if it matches the frequency that's in there, a strong muscle goes weak when you test it. So, with this technology, you literally can pinpoint exactly where things are. Example, I just had a patient in yesterday, and he had folliculitis, itchy scalp. Been to 4 different dermatologists. They're all scratching their head, literally. And and the bottom line is, when I did my testing,
It's contagious.
yeah, excuse the pun, but anyway, he had glyphosate in his scalp, and I said, Richard, do you live near a farm? He says, right next door, there's a big farm, and I know that he's using glyphosate. It's in his scalp. And so I put him on clay packs, kind of like what the Aborigines would use many years ago.
Right, sure.
So the clay packs have a negative polarity. The toxin has a positive polarity. It's like a magnet, and it's pulling the toxins out of his scalp, and his folliculitis is disappearing.
Interesting.
Well, what's the technology that finds? Is it just blood work? Is it
Frequency? No. If I take a vial
I
of
see.
glyphosate,
I see.
and I put it on different parts of his head, and I muscle test them, wherever it goes
I
weak,
see.
that's exactly where that glyphosate is concentrated. It's not going to show up in a blood test when it's trapped in the tissues.
No,
No way.
that is so interesting.
It's accurate, and it's effective, and it's non-invasive.
I always want to get to where, like, how do you fix all this? How do you naturally increase the levels of serotonin in your body, Dr. Smith? I mean, because you think about depression, every single time you talk to someone, like these inhibitors that you're talking about, these drugs, these synthetic drugs that are given to people with depression, they raise or artificially raise the serotonin level. How do you do it naturally?
Well, wasn't there a doctor years ago that said, thy food shall be thy medicine shall be thy food? Was that Edison, I think, Thomas Edison? It wasn't a doctor, it was Thomas Edison. So think about it. You have egg yolk. How many people go to a restaurant, oh, I want egg whites, no yolk? Well, the yolk is loaded with tryptophan. Tryptophan gets converted to serotonin. How about turkey? Thanksgiving,
Right.
you get sleepy.
Right.
It's the tryptophan
Right.
in there. How about nuts and seeds? They're loaded with that. And what I just discovered in my research for the show, pineapple is high in
Son of
serotonin.
a
Don't
gun.
know.
My wife
Plus
loves
tryptophan.
I eat it all the time.
Patty loves
I
pineapple.
do
She
too.
loves
Yeah,
pineapple.
it has serotonin in it and also tryptophan. And there's some other issues. So a good probiotic, for example,
Yeah.
reimplants the healthy bacteria in your intestines, which produce serotonin. Now, here's a sleeper for you.
Okay.
Vitamin D3. A lot of people are deficient in vitamin D3.
Yeah.
Just because they're not getting enough sunshine. But what's interesting, the D3 activates a gene which increases production of an enzyme called tryptophan hydroxylase 2, which converts tryptophan to serotonin. So D3 is more than just a vitamin, it's a pro-hormone.
Wow.
I take it.
So do I.
Me
So-
three.
So do
And I am number 3.
Right, exactly. You eat a lot of pineapple? No one look at her. She's always
love pineapple.
every time you come in, she's always look at her. She's always
I'm
happy.
happy.
She's always
You know,
smiling.
happy.
Yeah, because it's a happy hormone.
It's a happy hormone.
And plus,
serotonin.
it
I'm
also,
hormonal. Oh my
Yeah.
goodness, that's the first time everybody said, "Oh, she's hormonal." It's a good thing, right?
well, it can be, or it could be a witch on a broom.
Not Lisa. Not
Never,
Lisa.
never,
no
never,
way.
no.
No way.
It's too much estrogen.
Yeah. Is that what that is? Is that? Oh man.
I'm good. I'm good. Now the D3, I had some blood work done, just routine, and they said you're really deficient. I said, I don't go out in the sun. I mean, for whatever reason, but I take one every day, and I'll tell you,
You have to be-
I felt a difference.
Of course.
Yeah.
Now, here's a little caveat here.
Yep.
There's a lot of D3 that's out on the market that's
Yes.
made by irradiating lanolin to produce the D3. That's not really healthy. take mushrooms and they expose it to sunshine, and that converts the D2 to D3, a whole lot healthier. So you have to be careful. If you're taking the irradiated form of D3, it can be toxic to you.
How do you, when you go to a health store, how do you find out whether or not?
You have to ask the owner if they're familiar with the
process?
supplement. Yeah, I mean, I use Premier Research. They have a very high quality, very ethical company.
Yeah.
And I know because my patients that do before and after blood tests, it goes way up. And which brings up an interesting point, because I did an interview with you about cancer.
Yep.
Cancer patients have to have a high level of D3 because it boosts the immune system, up around 70 to 100 micrograms per milliliter. And doctors think that 30 micrograms or 40 are okay. No way. It should be normally 50 to 70.
Wow.
But if you got cancer, you want to boost it up.
Yeah. So the foods that you're talking about naturally increasing serotonin levels, pineapples, things like nuts, fruits,
salmon's
vegetables,
high
salmon,
in tryptophan. Now here's a little caveat.
Turkey, egg yolk.
Yeah. Here's a little trick that I picked up. If you eat complex carbohydrates, oatmeal, sprouted bread, fiber, vegetables, fruit, okay, it increases your insulin level. Now your insulin level increases absorption of amino acids, but it leaves the tryptophan high in your blood. It's a little tweak for your body.
Interesting.
And it's so simple.
So complex carbohydrates.
Yeah.
Okay.
Good quality. Yeah.
And what foods should we be avoiding in order to that suppress the serotonin levels?
Well, refined sugar, white sugar, it depletes the B vitamins, and that has to do with your neurologic health, the B vitamins. And also, people don't realize it, white sugar breaks down to alcohol in your body.
Interesting.
That's why people go to AA meetings that have 3-4 teaspoons of sugar in their coffee. They're getting their hit from that.
Yeah.
Any processed foods, especially the hydrogenated fats like Crisco or margarine, soy oil is no good, canola oil. It's okay to grease an axle maybe, but not in your body.
Not in your body, yeah. Wow. And when you talk about sugars, I mean, there's so many, every time you look at something, especially drinks, soft drinks, things like that.
High fructose sugar.
Yeah.
That tears up your liver. Seriously, it is unbelievably toxic. It's so much cheaper to use that. That's why they use it now.
You are what you, say that again, you are what you eat.
Hopefully.
Yeah.
Well, attitude's another.
It is, but it's driven by some of the hormonal levels in your body.
Yeah, but you know what's interesting? Deepak Chopra wrote a book called Ageless Body, Timeless Mind.
Yeah.
And in it, he gave a little explanation about a test that they did with rabbits. They had two groups of rabbits. They both fed the rabbits high cholesterol diets. The only difference is the one group of rabbits, they literally took out of the cage, petted it, spoke to it before they fed it the high cholesterol diet. At the end of the test, that group of rabbits had normal cholesterol in its blood. The other group that they just shoved the food in there, no contact and all, had high cholesterol. So mental attitude has a whole lot. So my philosophy is if you're eating Dunkin' Donuts or junk food, eat it with love.
Make it work for you.
Make it work for you.
Absolutely. And hug someone.
Yeah.
Well,
And hug a tree. And
Hug a tree,
A
please.
good chocolate donut helps put a smile on a face, don't you think?
Yeah, temporarily.
For about a minute.
A minute.
Exactly. Oh, wow. Well, so what about teeth? I know you've mentioned teeth, that they can be a real source of trouble. So how does that relate to depression?
Yeah, they say if you're not true to your teeth, they'll be false to you.
That's an old dentist joke.
That's an old
right?
dentist joke, right? But all kiddingly, extracted teeth, for example, you can get what they call a cavitation problem in the jawbone, which can fester for years and not have pain or swelling. Perfect example, had a young woman who had Hashimoto's, quote, autoimmune disease.
Right.
Well, one of her root causes was an infection where there's cytomegalovirus trapped in the jawbone where she had a wisdom tooth taken out 7 years before I saw her.
Wow.
So the infection, the toxins are drained through the lymphatics down to her thyroid. She also had an orthodontic wire behind her front teeth as a retainer. When I removed those 2 splinters, okay, or initiators, her Hashimoto's disappeared.
Interesting.
So the key is when they say, oh, you have autoimmune, that's because they don't understand the trigger.
Hashimoto's, is that where the thyroid is actually hyperactive?
It can be either hyper or hypo. Years ago, my daughter had Hashimoto's with an overactive thyroid. She couldn't sleep. She was like jittery and all. And the doctor wanted to put her on Tapazole, which was a drug to suppress her thyroid.
Right.
And she said, Dad, what should I do? I said, no way. So when she told the endocrinologist that my father said he's going to treat me alternatively, he quickly responded, it doesn't work. Well, when I tested her and I discovered she had the Epstein-Barr virus in her thyroid, and I put her on specific nutrients for that, 3 months later, all his blood tests were normal.
Wow.
What kind of nutrients?
In her case, noni tested strong and colloidal silver, and I lent her my Rife machine, which is a device that was developed back in the 30s, and it worked fantastically, but it was all suppressed because it was too effective without drugs.
Yeah. So you back to common medications causing medication or causing depression. I'm sorry.
Yeah.
Back to that conversation, doctor. You know, I don't think people are understanding that when they're not naturally increasing their serotonin levels, they're on specific medications like you said statins earlier.
Oh my God, statin drugs are got to be one of the worst out there. First of all, it generates $29 billion a year internationally.
It's huge.
It's a huge market, but it reduces your cholesterol. Now, your brain needs cholesterol to repair itself. That's why people get dementia. This is a given. This is not a maybe if. It shrinks your brain, you get dementia. It also causes type 2 diabetes. It also tears up your liver. It also causes rhabdomyolysis, which is a breakdown of your skeletal muscle tissue causing pain.
Wow.
And it only works in 1 out of 100 patients, statin drugs.
Wow.
Did you ever take one?
Lipitor's
Lipitor,
Crestor.
yeah.
I'm on a very, very, very low dose of that.
My advice is keep it between your knees. It works as a great preventative for getting pregnant.
Really?
Yeah.
Throw them away, in other words.
Seriously.
Yeah.
I just had a patient yesterday. I said, you got to get off this stuff. It's going to kill you.
Yeah. I'm on it because I had high triglycerides, and you know they're back to it was hereditary. I should go see Dr. Smith. I'm telling you, that's the only thing I take.
No. Exercise will lower it, and eating. First of all, if your thyroid's not working properly, and you can do an armpit temperature first thing in the morning before you get out of bed, and if your temperature is consistently below 97.8, that's a good indication that your thyroid's not working properly. You don't need a fancy blood test.
Yeah.
So if that's not working, your triglycerides and your cholesterol can be elevated from that. Exercise also helps lower triglycerides.
Yeah, I do. I may probably not as active. I'm on the bike 4 days a week. I get it. I get my heart rate up pretty good every morning, except for Wednesdays when I'm here. But I think I've got to work out a little harder, maybe.
Yeah, the bottom line is, it's like rust. When the joints get rusty, they get stiff and creaky.
Yeah.
And your body needs exercise to flush out the toxins from the organs and so forth.
Yeah. Great. Another great show. I love talking to you. You're
my pleasure.
Such a wealth of knowledge and so different from everything else you ever hear out there. And Dr. Smith always comes with something new, something different, outside the box thinking, which I love.
And things you can do.
Yeah, practically.
Practical.
Yeah, the practical
by yourself,
thing. Right.
Without, and every day.
Yeah. Well, the crime of the whole situation, you go to the physician looking for help, and he's giving you information based on research that's 20 years behind present-day research.
And not only that, you've said this before on the show, a lot of these physicians are getting, I don't want to say kickbacks, but they're getting perks from the drug companies that they're promoting. So Dr. Smith, thank you, sir.
My pleasure.
Yes,
Always a pleasure.
Always a great time with you. All right, ladies and gentlemen, we're going to go to commercial break. We will come back with more morning coffee after a message from our sponsors.
Boy, that went quickly.